Here's some ideas with the Auditory Squeakers. So if you have a package like this, it should have come with a small, a medium, and a large squeaker. And it's all just to use to grade the activity. So if you had someone who had a lot of pain and a lot of stiffness, say it was in their thumb, one exercise you can do is take any of the squeakers, but just have them try to see if they have enough strength to go all the way to the pinky. If it was hard at the pinky, then that's where you would practice it. Or if you were working on full opposition, then their goal would be to squeak at the very end. If they can't do that, you could always use a bigger one. And that requires a little bit more force, a little bit more strength, but less range of motion. Other things you can do is you can cut a little piece of clear elastic and you could stick it over the squeaker so that if you just wanted to hold it, that's all you would really need to do. Say I was working on MCP joint flexion of the fingers, or you could place it on the finger itself and then have them do it one-handed. You could have done the same thing on the thumb, again, just one-handed, kind of working down like this. So we're working on thumb, we're working on range of motion of the fingers. You can also do it where you're working on PIP and DIP flexion by just placing it directly down here and having them try to keep the MCPs in extension when they're just flexing the PIPs and DIP joints. So those are just some of the hand activities for the squeakers. Here are some ideas of how to use the auditory squeakers for someone that has, say, a stroke or a brain injury, or you're trying to, again, combine, you're trying to use the concept of coupling where you're using both hands at the same time for overflow. You can either use two balls or you can use two pieces of PVC pipe with maybe some Coban on the base of it, anything that they can place both hands on. So what the goal is to try to have them do coupling where, again, if they don't have the full extension of both fingers, maybe you can have them just use the hand itself like this or use a prop, is to try to have them at the same time as their good side to try to just move in whatever range of motion they can do, but trying to couple it with the good side. So what you're trying to get away from is this. And it's a type of cortical retraining that you can find in the research. It doesn't matter if the good side has to go further and the affected side doesn't have to go as far, but you just want to coordinate that movement with the sound. You can do it either forward and back together like we just did, or you can have them alternate between doing opposite motions here. So now you're breaking the symmetry of it, but still working on the concept of coupling. You can do this on a tabletop or take a little putty tack and put it on the wall and do the same type of movements, either alternating or synchronized. Same thing, doing more side to side here and side to side here. So really whatever pattern you want. And if you want it to be more diagonal, you can put a sticker on one side. But again, you're working in all planes trying to do coupling. So it combines auditory feedback with coupling. Other ideas for the auditory squeakers for the hand would be if you're working on extension of the fingers, you obviously look at their non-affected side to see if they have the extension that they're lacking on the affected side. And you can have them either just do with one squeaker, have them alternate, or have multiple squeakers here. So they have to lift and bring them down. And you can have them hold the palm of the hand so they really are working on extension. Or you can have them do abduction. So if they have a lot of weakness in abduction, then just have them squeak on whatever hand that you want them to squeak on, or whatever the fingers. Now, you can see I've placed stickers on some of these squeakers. And if you're wanting to work on visual perceptual, then you can even write on there, on the colors, you can write maybe on the red one, say blue, or on the blue, say red, or yellow, say blue. And you just give them some commands to just say, I want you to attune to the color that is written and not the one that's visual. And then you can say, I want you to do red, blue, yellow, 5 times, red, blue, yellow, but again, they have to attune to just the written word. So, if it said red here, you would go red, blue. So you're basically either telling them a sequence of commands of the color or the written word, and that's just a cognitive challenge. If I had like a ribbon or anything else that I would want to tape on the wall, you can either put some Velcro hook and Velcro on these to place on the ribbon, and like a finger ladder, you can have them either with their fingers do this, or if it was someone with a stroke or traumatic brain injury that they don't have the dexterity of their fingers, then you can have them whatever they had. It would give them a goal to try to either work on shoulder flexion or abduction, going against it, and squeaking, and that could be numbered so they could see, I got to number 5, now let's try to get to number 7. So some type of visual goal like that. And those are just some other ideas with the auditory squeakers. Oh, and one other thing is if you had like one of those Nerf balls, you could cut a hole in there and stick one of them in there and try to have them squeeze the ball with the squeaker inside. So almost like, you know, a toy, a dog toy. Or you could have them with your metal gripper. You can stick it with some Coban around it with a metal gripper, and then you can try to see it when they are gripping to try to make sure they're getting all the way to the end range by hearing that sound. Other ideas for the auditory squeakers? Here's some ideas with the auditory squeakers to try to target a larger joint, like the wrist or the forearm. If you have one of these from your Velcro roll board, you could easily use this, or you can use like a lint roller. All I did was just take one of the flat squeakers and I put some Velcro at the bottom. You can use any of the squeakers though. And then I taped some hook on the back of this. So for example, if you wanted to work on supination, pronation, you would just place the squeaker on the roll just like this. And you can use, this is a little ice bucket. You could use your TheraPutty container, or really anything that you have. You can stack books up, whatever you have available to you. But now you're using it as biofeedback or auditory feedback. If they are really stiff in pronation, then their goal would be to squeak here. And if that was too hard, you could always make it bigger or use a bigger squeaker. So here you could have them do just pronation, or you could have them do just supination, or you can have them alternate pronation and supination. If you wanted to do something more for like radial ulnar deviation, same thing. You just take your bucket of putty and then just have them isolate their hand here, work on supination, pronation. And if you placed it just down here, you can have them work on either just slight elbow flexion extension here, like this, like that, or even better than that is to have them lie in supine, and while maybe you're putting some heat on their elbow, then they, on the bottom of the mat, they would have to reach all the way to the bottom of the mat to try to get the elbow into full extension, as well as going into flexion. So I like to just place some moist heat there and then make it so it is challenging for them so that they can just barely get it. And once they have a strong squeak, then you have them lower it down. And if you think about that same concept for the shoulder, against a wall or against the mat, you can have them raise their elbow up and you can have them squeak either on the wall or on the mat to get full either shoulder flexion or shoulder abduction, like this. So it's that auditory component that allows them to know that they've reached their goal. And those are just some ideas with bigger joints using the auditory squeakers. Some tips for the lower extremity is to have your patient put not one pair of socks on, but 2 pairs of socks on. And after they have the 2 pairs of socks on, you have them slip in your thinnest squeaker onto the heel of the foot. So now if you're working on someone that's toe touch weight bearing and they do strike their heel on the ground when they walk, every time they walk, then it'll tell you whether or not they truly are toe touch, because they shouldn't be hearing the squeaker. Or you can work with a pediatric patient or someone who's a toe walker. If you did want them to strike the heel, then you tell them that their goal is to get that auditory component. So then same thing, you can do 2 pairs of socks, maybe the bottom one with the tread to make sure they don't slip. And then their goal is to try to squeak each time. So then that's going to be a positive reinforcement to hear that instead of a negative reinforcement, like your toe touch weight bearing. And then, of course, you can use these I do the LSVT program, the big and loud, where you're bursting in and out. And then if I really want them to try to touch a certain area, then I may have this as a tactile reinforcer that they're getting far enough into the range of motion. So lots of ideas, not just for your orthopedic patient, but also for your neurological patient.